Hey guys, now we're going to talk about the anatomy of axilla. So the axilla has boundaries. It has an apex, base, and walls. Alright, so the axillary region, which is the region that is bounded by walls, it has an apex, base or floor, and then it has anterior wall, posterior wall, lateral wall, and medial wall. So what is the cervicoaxillary canal? It's basically the apex. And how can I remember the entrance of the axillary region? You just think about an area that is here. If the apex is here, then the canal is basically bounded by the first rib, the clavicle, and the superior border of the scapula. So this is a top view of thoracic cage with the bones of the shoulder girdle. So the cervicoaxillary canal, it is a cervical because it's related to your skin, axillary because it takes structures from the neck, cervical region in Latin, to the axilla. That's why we call it cervicoaxillary canal. It's the passage of the structures from here to there and from there to here. Who is from here to there? From here to there is going to be your axillary artery. It's going to be your brachial plexus because they formed here in the neck. What's going to be from there to here? It's going to be the things that were formed down and coming back up, which is going to be the vein. For example, the axillary vein, the lymphatics, it's basically draining from the periphery to the central region. So it's basically the passageway that will be the communication between the axilla and the neck region. This is the cervicoaxillary canal, and it is bounded, like I said, by the first rib, the clavicle, and the superior border of the scapula. Now, how would we know the walls? It's very simple and easy. Just try to open up your arm. Think about your arm as the lateral wall. Put your hand on your upper four ribs. This is your medial wall. The scapula is at the back, and then your chest and the muscles related to it is going to be your anterior wall. Now let's try together to memorize the structures that make up the walls of the axilla. Like I said, your arm is here. It's the bone. You're holding your proximal humerus right now. So the proximal humerus is the lateral wall, and you have a very important intertubercular sulcus in the proximal humerus, so that will be included in the lateral wall. And then you have the coracoid process of the scapula. It's also related to the lateral wall, and the muscles attached to it is going to be also your lateral wall. So what are the muscles attached to the coracoid? The muscles attached to the coracoid are three muscles. One is the coracobrachialis, and it's easy because it has the word coraco. The other one is the short head of biceps. You have your biceps. It has two tendons. It has long head and short head. The short head goes to the coracoid, and the long head goes to the glenoid, supraglenoid tubercle. I'm going to talk about the muscles of the arm later on, but just remember that the coracoid is related to three muscles: short head of biceps, coracobrachialis from here, and pectoralis minor from there. All right, so these will be making the lateral wall. So the lateral wall, the upper or proximal part of humerus, the intertubercular sulcus, and then the coracoid process, the long head, the short head of biceps, coracobrachialis, pectoralis minor from here. And because you guys, the long head of biceps runs in the intertubercular sulcus, and it has another name, remember, the bicipital groove. So also the long head is related. We can say the tendon of the long head of biceps is also in the lateral wall. All right, so these are the structures that make your lateral wall of axilla. It's very simple and easy. Now, what are the things that make your medial wall? Your medial wall basically is your upper chest. Okay, now you are abducting your arm and trying to imagine that region. All right, so the upper four ribs is your medial wall, and remember that the serratus anterior, guys, it was coming out of the ribs. All right, it's serrated muscle. It comes out of the upper 8 ribs. So definitely if the first 4 ribs are my medial wall, then the four parts coming out of those ribs of the serratus anterior will be also my medial wall. All right, so the serratus anterior muscle and the upper four ribs are my medial wall. Now, what about the anterior wall? It's your pectus region, all right? This is your chest, all right? And what are the muscles? It's your pectoralis, all right? The muscles are pectoralis major and the minor is below it. So these are the anterior, because now you're trying to imagine the axilla on yourself. This is your lateral wall. This is the upper thoracic part is your medial wall. This is the pectoralis, okay? And the pectoralis major, guys, makes something called anterior axillary fold. You guys can hold your fold right now. You can try to hold the anterior axillary fold. And then the posterior wall and the posterior axillary fold is made by latissimus dorsi and teres major. So what are the muscles in the posterior wall? It's gonna be basically your latissimus dorsi, teres major, and then also you have the subscapularis, because you guys, the subscapularis is definitely part, because these are the three things: latissimus dorsi, teres major, and subscapularis. So this is going to be the posterior wall. Just keep this picture in your mind, and with that you will be knowing all the walls very easily. So the upper four ribs and serratus anterior, medial wall. Laterally, upper proximal part of the humerus with the intertubercular sulcus and the tendon of long head of biceps in that, and the coracoid process and the three muscles attached to it: pic minor, coracobrachialis, and short head of biceps. All right, and then you have the anterior wall, which is pectoralis major, and the minor is deep to it, and the posterior wall is basically the latissimus dorsi, and then teres major down there, and the subscapularis, definitely, because the scapula is already in the posterior aspect. All right, now that takes us to a next concept, which is very important. It's the axillary lymph nodes. Axillary lymph nodes, guys, is important because, you know, an infection or a malignancy, spread of malignancy, it's very important to come to know about the axillary lymph node and any lymph node in general. We're going to talk about the lymph nodes now. And if you want to understand the basic knowledge about the lymphatics, I have another video called I think, what was the name? I will add it to the playlist. It is called Overview of Lymphatic System. If you want to understand how the lymphatic system work, because when you take regional anatomy, we don't take you back to the whole system. We just talk about the lymph nodes, but those lymph nodes eventually drain into vessels, and from the vessels they drain into trunk, and from the trunk they drain into ducts, whether it's thoracic or right lymphatic duct, and from there they drain into the junction of internal jugular vein and subclavian vein. So to understand the whole thing, you need to just have an idea about the lymphatic system. But now we're going to talk about the lymph nodes. Now, what do we have? We have groups of lymph nodes. I love this picture, which is made by those guys. It's just drawing the lymph nodes in a simple way. You have anterior axillary lymph nodes, you have posterior axillary lymph nodes, you have lateral axillary lymph nodes, you have central, you have apical. All right, so based on what we said, this is anterior because it runs on the anterior wall. What do we have in the anterior wall? We have the PIC muscles. So the anterior axillary lymph nodes are running at the lower border of PIC minor. Now, what about the posterior? It's in the posterior wall. What did we say about the posterior wall? We said it's a scapular region, subscapular region. So the posterior axillary lymph nodes, they run around the subscapular vein at the lower border of subscapularis muscle. So the anterior, they run at the lower border of PIC minor with the lateral thoracic vein, because lateral thoracic runs here. All right, and the posterior axillary lymph nodes, they run on the posterior wall, and we said that that wall is related to the scapula, so it makes sense that the posterior axillary lymph nodes, they run around the subscapular vein at the lower border of subscapularis muscle. So we have muscle here, lower border, muscle here, lower border, anterior wall, posterior wall. Now, what about the lateral? The lateral, you guys, is related to your upper limbs. It runs around the axillary vein, around the lateral wall. It's the upper humerus. All right, this is the lateral wall, and you guys know the lateral wall by now, and that drains from the upper upper limbs. And I'm going to give you just an extra information that will stick with you in your medical life. The lateral nodes, they drain lymphatics from the upper limb. And those lymphatics, the lymph nodes, they drain from the breast and your body. So the anterior axillary lymph nodes, they drain from the chest, all right, and supraumbilical region. So this is the chest, all right, so this is the chest and this is the supraumbilical region. They would drain into anterior lymph nodes. And of course, the posterior, they drain from the posterior thoracic wall and subscapular region, all right. And now after that, I didn't say the information, but let's just finish this topic. And definitely that will get into the central, and the central is within the base of the axilla, and it runs in the axillary fat. It's in the center, and they will drain into this, and eventually that all needs to go to the apical, and they can also drain into the apical. So they will subscapular, it drains from the subscapular region and posterior thoracic wall. Anterior group of lymph nodes draining from the anterior chest and supraumbilical regions, and these will drain into central mainly, and from central to apical. They can also drain into the apical, all right. What about the lateral? Lateral also needs to drain into axillary, and from axillary to apical. And from that, you're going to form those efferent vessels. And the efferent vessels need to go all the way to drain into the lymph trunks. And in every region, there are names of trunks. And those trunks drain into ducts. All right, so lymphatic ducts. And those ducts would be the thoracic duct or right lymphatic duct. And from the ducts, the thoracic duct drains from all of your body. I know I'm not explaining that into details because I have already a very nice video explaining how the trunks, the ducts, and how they all drain eventually, and how does the system work. So that's why I don't want to get into details of that. You can go ahead and see it. Now, I just want to take you to the final destination, because eventually we need to drain into the heart, right? And the heart is basically by a union of brachiocephalic right and left, and that will drain into the superior vena cava. Now, what do we have here? We have the internal jugular vein, and we have the subclavian vein. Where is the opening of those ducts? The final ducts that takes from the trunks, and the trunks were coming from the vessels, and the vessels were getting from the lymph nodes. Where does the duct need to open? They will open into the junction, and that is the union between the subclavian vein, which was bringing veins from the upper limb, and the internal jugular vein that was bringing drainage from the head and neck. So that will eventually go into the right brachiocephalic if we are on the right side, and from the brachiocephalic you go into the superior vena cava, and from everything you will get into the right atrium, and from there, it goes on. So the thoracic duct drains from all of your body except the area supplied by, the area draining by right lymphatic duct. And the right lymphatic duct comes from the upper part of your body. This is your right and this is your left. So the right lymphatic duct will come from here, all right, and everything else is gonna be by the thoracic duct. So everything, this is your head and neck, and your body and lower limbs, everything else will come from the thoracic duct. All right, if you guys need to know more details about that, you can go ahead and watch that video. The last thing I want to say, the axillary lymph nodes are very important in the breast cancer malignancy, and that information, if you want to dig deeper into that, you can find that in the reproductive module playlist. You will find it in the anatomy of breast. I explained all about the groups of lymph nodes and how they drain lymphatics, and how can the breast cancer spread into surrounding region. The only thing I want to say here at that level is the breast cancer malignancy can spread into different region, and the only one that is not affected in breast cancer is your lateral lymph nodes. All right, this is just an extra information. You will come to know about that in the reproductive module, anatomy of breast. But because the lateral lymph nodes, they drain from the upper limb, they have nothing to do with all the people and guys in here. So that's why you might get a question like that: which of the following axillary lymph node that is not affected by breast cancer malignancy, which is going to be your lateral axillary lymph nodes, although it is axillary, but it's not related to breast cancer. The last thing is here, guys, I want you to see the content. The content of axilla is very simple and easy, and by now we know that we have axillary vein, we have the axillary artery, and we have the infraclavicular part of brachial plexus. The extra note I want to say here is a nerve, and that nerve is called the intercostal brachial nerve. Intercostal brachial nerve is a cutaneous nerve. It comes out of the second intercostal nerve. You can spot it at the level of the second rib. You don't usually find it in dissection holes because it's a cutaneous nerve and it's easily cut. That nerve goes and gives supply to the shoulder region and the medial chest and upper medial part of your arm. Like you can see here, it runs obliquely in the axilla and it tries to reach the upper limb posteromedially. That nerve is important for physicians or surgeons because it can be easily injured during axillary surgeries or brachial plexus block or any thoracic, proximal thoracic surgery, and because that will give numbness and, you know, signs and symptoms because of the loss of cutaneous innervation of this part of your medial wall of the thorax and medial part of your upper limb, upper medially and also shoulder region. So it's important to know about the intercostal brachial nerve. And as you can see, it goes to the fat here because it means this is going to the skin. All right, so this is an important content of the axilla. Other than that, everything else you guys already know. Like we said, we have the axillary vein, we have axillary vein, we have axillary artery, and we have the lower infraclavicular parts of the brachial plexus. Thank you guys for watching and see you in the next videos.